This portion of CardioSource Video News is brought to you by Medtronic.
Welcome back to CardioSource Video News. A very interesting trial is called the PERfECT STENT trial, which looked at patients with de novo coronary artery disease. It evaluated a paclitaxel-eluting balloon in patients treated with endothelial progenital cell capturing stents. Dr. Peter Block now joins us with the latest from the Washington Convention Center. Peter?
Okay, well, I'm here with Professor Jochen Woehrle from Ulm in Germany, and he has just reported on the PERfECT STENT trial. Now, the PERfECT STENT trial isn't really about the perfect stent, is it, Jochen? But tell me what the PERfECT STENT trial actually is.
Yes, you're right. It's not the PERfECT STENT, but the study is called PERfECT STENT study. And we looked in workhorse lesions, de novo lesions in native coronary arteries, whether a strategy combining a paclitaxel-coated balloon plus a EPC stent, an endothelial progenitor cell capturing stent, is superior to an EPC stent alone. The EPC stent has human anti-CD34 antibodies in the surface, and these antibodies capture endothelial progenitor cells from the bloodstream and facilitate stent endothelialization, strut endothelialization, and may be associated with a lower risk of stent thrombosis. So we have looked in 120 patients in a prospective randomized multicenter single-blinded trial to look whether the combined strategy is superior regarding an angiographic endpoint, the in-stent late lumen loss. We had 62 patients in the balloon-coated group plus EPC stent group compared to 58 patients in the EPC stent group alone. We had a very high angiographic follow-up rate with more than 95% in both groups at 6 months and 100% clinical follow-up at 6 months. Dual antiplatelet therapy was given for 3 months in both groups.
So let me just interrupt. Now, this is a 6-month follow-up at the present time, but you're going to be doing a longer follow-up, aren't you, Jochen?
Absolutely. We will follow those patients up to 5 years.
Okay, so tell me what the outcome is.
The outcome is positive. The study met its primary endpoint. The in-stent late lumen loss was significantly reduced. It was 0.88 millimeter in the EPC stent group alone compared to 0.34 millimeter in the EPC stent plus paclitaxel-coated balloon group. We used the drug-coated balloon, the Sequent Please from B. Braun, Germany. I think this is an important point because there are several drug-eluting balloons on the market. We have chosen the length of the paclitaxel-coated balloon to be longer than the stented segment, 1 to 2 millimeter long on the proximal part of the stent and 1 to 2 millimeter long on the distal part. And we are also able to show a significant reduction of the late lumen loss in the proximal 5 millimeter to the stent from 0.21 down to 0.04 millimeter, the same amount of reduction in the distal part and a significant reduction of late lumen loss in the total stent segment. This translated into a significant reduction of the binary angiographic restenosis rate from 21.4 down to 5.1% in the stent group, as well as a significant reduction for the total segment. And we had a trend towards a lower target lesion revascularization with the use of the paclitaxel-coated balloon. We had no stent thrombosis in both treatment arms. We had no myocardial infarction related to the target vessel, and we end up with a MACE rate which was significantly lower in the treatment strategy with a paclitaxel-coated balloon plus the EPC stent compared to the EPC stent alone.
Well, you know, those are very promising results, Jochen. So it looks as though possibly some of those trends in the longer term will end up being significant. So congratulations. It may not be the PERfECT stent, but this is the PERfECT stent study. Thank you.
Thank you very much.
Medtronic proudly introduces Integrity BMS, now available in the U.S. Visit MedtronicStents.com for more information